Thank you everyone for joining us today for today's webinar titled Street Homelessness Across African Cities. This webinar is co-hosted by the Institute of Global Homelessness and the University of Pretoria. We just wanted to share a few housekeeping items. We want to notify everybody that this webinar is being recorded for the purpose of sharing afterwards with everyone. Also, as I said before, please use the chat to introduce yourselves, to also discuss throughout the webinar, to share information and things like that. And then the Q&A function, which is a separate button. Please use that to submit questions that we will share during the question and answer segment at the end of the agenda. Um, and these will be questions that you can ask the panel and we will have knowledge exchange. Just a few acknowledgements. We want to acknowledge diversity, equity, inclusion in the homelessness sector. Structural and systemic racism looks different throughout the world, but we see an undeniable through line and correlation between racism and homelessness. And we want to acknowledge that homelessness disproportionately affects Black and Brown people and historically marginalized groups of people due to this systemic issue. IGH is committed to actively working to counter racism and inequities within the sector to help prevent and solve the issue. We also want to make a land acknowledgement. IGH sits on the indigenous land of the Council of the Three Fires, Potawatomi, Ojibwe, and Chippewa, and we are happy to share the link if you would like to find what indigenous land you live or work on in the chat. Also, just an overview of the agenda. I'm currently giving welcome and housekeeping. My colleague Julia will give an overview of the Institute of Global Homelessness. Stefan De Beer will present on his work at the Center for Faith and Community at the University of Pretoria. We will be joined by Eric McCoya, who will share about addressing homelessness, street homelessness specifically in Nairobi. Sia will give a presentation on addressing homelessness in Johannesburg, South Africa. Um, and then we will have a question and answer segment and close out afterwards. Um, oh, sorry. Also, we would like to share sorry. Um, just a brief overview or introduction to the Institute of Global Homelessness. We were founded in 2014. We are based in Chicago, but we were founded between DePaul University and DPI. We are the first organization to focus on homelessness at the global level, with an emphasis on street homelessness. And our three buckets of work, we have tagline into See It, Solve It, Share It. See It represents our advocacy work for international policy, focus on definition and measurement. Our Solve It bucket of work summarizes our work to partner with cities and countries in various regions around the world to help them meet their local goals to end homelessness. And our Share It bucket of work summarizes our knowledge exchange work. So, convenings, webinars such as this one, to share knowledge about proven practices and addressing challenges within the work. And then also, please engage with us on social media. You can find the Institute of Global Homelessness on YouTube, LinkedIn, Facebook, Instagram, and Blue Sky. And we also encourage you to email us if you have any questions about anything, suggestions, or if you want to connect with us. Um, And I think I'll turn it over to my colleague Julia, who will give an overview of the Institute of Global Homelessness.
Um, Thanks, Tiffany. And so for my presentation, I'm going to focus on IGH and our work globally, and then also touch base on our work in both Tshwane, South Africa, and Cape Town. And so, as Tiffany said, our role at IGH is to drive the global movement to end homelessness and to support partners around the world and to build the global evidence base. And so this map encompasses our work across cities. So we have partners and networks beyond this, but this is our city-based work from our Solve It pillar. And so with our Vanguard Cities program, we currently support 18 communities, and then we also have the International Mayors Council. And so we have cities across all six continents. And with our Vanguard Cities program, we aim to support cities with a motivating goal, to support measurement, and then also to build the knowledge exchange community and share what works. And so, we know from the research and from our work with cities that even though the context may be different, the solutions and the best practices, can be adapted across contexts. And so the learning community really aims to share what works and also support cities through challenges and barriers. And also, with this, we aim to build a local to global spotlight and so share what cities are doing at the global level with our partnerships at the UN and with other different forums as well, because we really see that there's innovations and best practices across all of our cities and across all six continents as well. So just a little drill down on Tshwane, and our partner Stefan De Beer is going to be speaking much more in detail, but Tshwane signed as a Vanguard city in 2018, and Tshwane, the partners there worked to set the first homelessness policy and also work to build really a collaboration and, and improve the measurement across the city. And so these are the initial lead partners that signed, and then we also now have expanded our partnership with the University of Pretoria as well, and working to expand that with the city of Tshwane. With Cape Town, Cape Town is our newest Vanguard city. We are proud to have partnered with them in November 2025, and we signed with the city of Cape Town, but we really also that's also supported by the nonprofits that are working to do the important work in Cape Town. And so Cape Town set both quantitative and qualitative goals. Their quantitative goal is to achieve prevented rare, brief, and non-recurring street homelessness, and then also strengthen collaboration and expand access to safe accommodation by 2030. And with this work, we're aiming to kind of understand the work with the city to understand the drivers of homelessness, build out prevention programs, work to have better street engagement protocols, and then also understand kind of what are the different mechanisms to have positive exits from shelter as well. So this is just an overview of Cape Town. And so with our Vanguard Cities program, 2 weeks ago, we launched a case studies report detailing innovations and best practices across 11 of our Vanguard cities. And so this includes Tshwane, it includes Buenos Aires, Sydney, Greater Manchester, Santiago. And so we can share the link to this report as well. So with the case studies report, we aim to analyze what works across the cities, identify challenges, and explore lessons that can be applied globally. So in the report, we detail prevention, housing first, examples of integrating lived experience as a crucial way to have more effective programs, innovative housing approaches, citywide systems, data collection, and best practices and key learnings. So specifically for the Tshwane case study, we the Tshwane, so Remembrance and Stefan's team highlighted two of their programs. So one was the Manifesto on Elderly Homelessness, and the other one was the program From Hotspots to Safe Spaces. And so with this, both of these programs highlighted in the case study really focused on the participatory and collaborative nature that Tshwane has really embodied. And so it really highlights how it's so important to involve people from across the sector and from across different organizations. So everyone from researchers, people of lived experience, NGOs, city officials, and provincial authorities in order to kind of make that collaborative difference, which is so important and has been so effective in their approach as well. And as part of our work at IGH, we aim to understand homelessness globally, and that includes homelessness measurement. As part of our first pillar of work, See It, we aim to improve the number of countries that are defining, measuring, and creating actionable data that informs policy. And so we created the Global Homeless Data Map, which analyzes all publicly available data. And from the map, there's currently only 78 countries that have ever published official government data on homelessness. And then looking specifically across Africa, there's only 10 countries that have officially published data on homelessness. And we're going to kind of get into some of the details about how homelessness is not as visible in Africa and different ways to do that. But I think this also points to the fact that we need better data and we need more countries committing to action on homelessness in across Africa as well. So, as I said, with IGH, we work to support the United Nations, and with our support and with the work of the NGO Working Group to End Homelessness, which IGH is a part of, we've seen significant progress at the UN, and so there's been several resolutions, calling for action on homelessness, and then there's been two Secretary General's reports on homelessness. So that the second report came out in 2025, and in the Secretary General's report, it really identifies the gap that homelessness is not being acted upon to the nature that we need globally, and even though it can be one of the most visible forms of poverty, we don't see action, and it's creating greater inequality and leaving people behind. And the Secretary General's report also calls out that criminalization and other punitive measures don't create they create more barriers, and those things need to be stopped in favor of more human rights centered and data informed policies. So just wanted to highlight this as a connection from the global to local, and we can share the link to this report as well. So that's just a brief overview of IGH, our work with cities and our work on data. So you can check out our website, and then also feel free to email me with any questions, or if you're looking to kind of join any of our programs. So I'm going to turn it back over to Tiffany. Thank you.
Thank you, Julia. Now we're going to have our lovely partner, Stefan De Beer, present. He is a professor of theology, and he's the director of the Center for Faith and Community at the University of Pretoria. Over to you, Stefan.
If I can just get my screen to, can you see my screen?
Yes, we can. We can
Because I
see.
cannot see. When I share it, it disappears from my, for some reason,
On your
sorry, just
side.
give me my whole screen becomes so small I can't see anything when I share it.
Oh,
I
I'm
wonder, can
happy
I
to share
ask you
it.
to, can you please? That will just, that
Yes.
will be smoother. Yeah, and one
Okay.
day when remembrance from the unit and I are big, we would like to do beautiful presentations like yours. Um, in the future, we'll send our presentations to you to dolly it up before we present.
Okay, 1 second.
Thank you. It's nice to be in this space and to see names that we know very well, but also to see new names of people, which is, I think, part of the reason for this conversation is to broaden the base of our network.
Okay, can you all see my screen?
You can see it.
And you can see the PowerPoint, right?
There you go. All
Okay.
right. Okay, so thank you. Within the University of Pretoria, we have something called the Unit for Street Homelessness. You can go to the next slide, and then I'll start to speak to that. Um, it is located in a small center called the Center for Faith and Community. And in 2021, I suppose, as an outcome of what happened during COVID, we created a unit for street homelessness as a more dedicated space for transdisciplinary scholarship on homelessness. I suppose we realized that in South Africa and even on the continent, there aren't spaces that, in a dedicated way, over a long period, focus. There aren't academic spaces that over a long period focuses on street homelessness as a topic, to generate the kinds of data that can not only support existing practices but that can also inform policies and so forth. And so it is a dedicated space for transdisciplinary scholarship, working with various disciplines, theology, health sciences, anthropologists, town planners and architects, and a range of others, but also with community practitioners, people with lived experience of homelessness, and then, of course, with government officials to find solutions for complex challenges. So that's really what the unit is committed to. The next slide. Can you just skip to the next one? Maybe just to situate it, Pretoria is the administrative capital of South Africa, but it's part of the bigger city of Tshwane metropolitan municipality with 4.1 million people. And for those who know Johannesburg better, it's adjacent to the cities of Johannesburg and Ekurhuleni, part of a city region where actually those of you who will be with us in January will realize that actually there's not any space anymore between these cities. So it's actually becoming a growing city region with about 16.5 million people. As Julia already has spoken about the Vanguard City project of the Institute, and our specific commitment is to the reduction of homelessness generally and among specific populations. I'll get back to that in a few slides. What was important for us is in 2015, we entered into a social contract in our city that involved the city of Tshwane, the municipality, the Tshwane Homelessness Forum, which is a broad-based network of civil society organizations, non-profits working in the homelessness space, the University of Pretoria, and the University of South Africa, with the purpose to collaborate in research, but also in action and policy work in order to prevent and address street homelessness, as I said, collaboratively. You can move to the next slide. I suppose the foci in the right sort of circle there is an understanding that when we speak homelessness, it's psychosocial health issues, but also economic and housing, and there are often legal, institutional, policy, and budget elements. So in the research we do and in the policy interventions, we try to have people at the table that can help us think through all these different areas, the intersections between these areas, because our understanding is that sustained pathways out of homelessness actually need for all these spheres to collaborate quite well. In the first little circle, you'll see that I suppose the unit's methodology is that it's very immersed in terms of our research. Our research and documentation try to develop the kind of data and documentation that can be helpful not only to other academics, but can be helpful to policymakers, but also to people who are actually practitioners working on at the coal face. Increasingly, in the last few years, we've done policy work, both in Tshwane but also nationally. Since COVID played a strategic coordinating role, and I'll come back to that. And then the importance of getting the information and the knowledge that we gain and generate through the different processes out through dissemination and building also awareness campaigns. And I'll touch on that shortly. You can move on to the next one. So I will quickly speak about four main areas. Pathways Out of Homelessness is the title of a multi-year research project that contributed and still contributes to new knowledges in street homelessness in our city, captured in articles, policy, research reports, and a book project. But actually, those are not the most important necessarily. The most important are really where it touches on policy, on budgetary allocations, on more bed spaces, and on people sustainably exiting homelessness. We are currently collecting a cluster of articles that will reflect on the last 10 years of very dedicated homelessness research in the city of Tshwane, but also reflect on the actual policy that the city has adopted as a result of the research, and seeing how far the policy is actually making the kind of impact we hoped for, because also since COVID, there are new questions, there are new realities around homelessness, there are new vulnerabilities, and so the journey still continues. So Pathways Out of Homelessness is the research collaborative with people from all kinds of disciplines. I see two of our colleagues from health sciences are on this call as well, who has done amazing work, especially with substance using homeless populations, but also trying to work with us and people on the ground in terms of creating a bridge between access to primary health care, for example, and street homeless populations. The next slide speaks to the Pathways Operational Center that Julia alluded to. You can just go to the next one. And this is very high level just because I have been given a few minutes. So I think COVID was for us a highlight when we were tasked to manage the city's risk reduction strategy for homelessness. And in a very short period, and we've published on that, in basically a period of 10 days, we had to pull together 27 temporary shelters housing about 2,000 people who all had access in that time to primary health care. The disaster in some ways became good news. And sadly, at the end of the disaster, whilst the disaster continues for people who are street-based, that kind of will and the mobilizing and the focused, dedicated, focused, collaborative attention actually didn't last. And so, but we still draw from that to say if it was possible in those 10 days and in those 3 months, it's always possible. And so we still want to draw from that and remind ourselves of that. We did the first Tshwane homeless count in 2022, and the next one will be repeated in March in 15 days. We were reminded this morning with the slogan, "Everybody counted counts." This year around, we're quite excited because we are doing it quite collaboratively with Statistics South Africa, which is the national department dealing with census and statistics. In the previous round of the census, both in Cape Town and in Tshwane, we realized that our data arrive at very different places. So in Tshwane, the official census showed many more people than our counts show. And in Cape Town, the guesstimates are that the numbers that the census showed are way below what those on the ground in Cape Town says. So with our collaboration with Stats SA, Statistics South Africa, they helped us with creating the instrument for the survey. They will help with data analysis, and we also plan to publish afterwards to actually critically engage with methodologies of cities doing point in time counts, but also the official methodology of Statistics South Africa, and seeing how far we can learn from our different lessons, but also improve on methodologies. We also, through the operational center, monitor the city's implementation of its own policy, and recently was asked to review the policy, which is curious because some elements of the policies is not yet implemented by the city itself, but that's part of the ongoing conversation between the different partners. Next slide is, I suppose that's the one on building campaigns, very much coming out of the data of the count and ongoing collaborative work. I think one of the things we're learning from this is that we just, unlike a person like Sia, who will speak later, some of us are not as good at building campaigns. We can do all kinds of things, but campaigns are not necessarily our strength. So just saying that as well, because we realize that this is becoming more and more important. The lead one is around ending holder homelessness, where we have quite accurate data on older persons, 55 and older, but also 65 and older, who have been on the streets for quite some time. And through this campaign, definitely wanting to end older homelessness through strategic interventions. There are other campaigns that we are looking at, campaigns, but also long-term work. The reality of migrant women and children, transnational migrant women and children, is becoming more acute, especially in a context of xenophobia and anti-migrant policies. As they play out, for example, in South Africa right now, if you run a shelter in our province and you accommodate migrants, you run the risk of losing state subsidies completely for all, even the locals. So there's a challenge. We realize there's a challenge around certain groups among the LGBTIQ population who are excluded because of heteronormative criteria in mainstream shelters. We've done a research piece on hotspots in our city and how to move from hotspots to safe spaces, and that research still needs to be translated into concrete action. And then there's an ongoing, I suppose, advocacy research connection around moving people sustainably from the streets, not only into shelter, but into supportive or special needs housing, experimenting with housing first options, but then also what will it look like for people to sustain themselves in housing in the market. I think I have 2 or 3 slides left. I'll try to rush. The next one, please. So nationally, way back, we helped launch the National Homeless Network. And sorry for those South Africans on the call who will say we claim it, but we do claim it, that we were part of that in the beginning. We're still a partner in the National Homeless Network, where people from across South Africa, from different cities and towns, connect, learn, advocate. We're annually convening in another city, and I think it has become a special place. The last meeting was in Cape Town last year, which was really a special time, where officials from government, practitioners, researchers, and people with lived experience gather and inform each other. Some of us in this call was part of a panel that drafted a green paper on street homelessness for the National Department of Social Development. These are not linear processes. You do that and then nothing happens at the end of it, and then you have to regroup and say what now. The purpose of the green paper is, of course, to engage broadly with all partners for the green paper to be adopted, to become a white paper, in the end for it to become an act of parliament. And so we're working towards that, because that will also allow for National Treasury to allocate budgets across the country to municipalities, because right now that's one of the challenges. Many municipalities are saying that they simply do not have budgets. Although they experience homelessness at coalface, they depend on National Treasury to allocate funds, and this becomes a challenge or an excuse, one of the two, or both. The next slide. The next slide is really asking what about beyond. And so now I want to turn it back to what we are here also for today. Kind of for some of us, maybe not IGH, but definitely for us, we see something that's happening in January in South Africa as an excuse to try and get to speak to as many Africans from across the continent in preparation. Street homelessness seems to be a hidden reality on the continent behind the much more visible reality of urban informality. 62% of African urban dwellers, we are told, are living in slums or informal settlements. So that's just such a enormous reality to deal with, that then street homeless persons who are actually living under the sky, as people in Bangalore or Bangalore will say, are often excluded and in research not surfacing that well. Who are the people doing research, policy work, and activism on street homelessness in African cities and towns? That's the question, really, because we don't speak to each other. Um, and so this is the question we're throwing out, and it doesn't have to be answered today, but we want to explore the possibility of an African homelessness network. Now, it sounds spectacular. I'm not necessarily speaking of something spectacular, but a space, a platform for those who are committed to this space, researchers, activists, policymakers, who really want to address street homelessness in a constructive way in their own places, to maybe figure out ways to convene, to share, to co-construct. And now the IJOH conference that I think probably everybody on this call will know about, because that was part of I think inviting people also to today in January 2027, is a good reason to start this conversation with each other on the continent, which brings me to the last slide. I think my last slide is basically just a little advert. So the International Journal of Homelessness launched a couple of years ago. The first conference was in Chicago. The second conference was then in Chile, am I right? In beginning of last year. And so in January of 2027, it will be hosted at the University of Pretoria, but together then with IJOH and the Institute of Global Homelessness, but also our friends in the rest of South Africa, in Cape Town and others. The full 5 days that is on here will not necessarily be the conference. The conference will be 3 of those days, but we put these dates because we would like to offer spaces for site visits before and after, so that people can also get a sense of some of the interventions and practices and challenges, not only in Tshwane, but also in Johannesburg, in our region, because it is a region that is also, like all our cities and towns, that people can learn from, draw from, both from good practices, but also from challenges. So I think I'll park it there. Thank you, Tiffany. And thank you for those who are joining us on this call as well.
Thank you so much, Stefan. What a great presentation. So many insights that you touched on. You kind of reflected back on the COVID pandemic and how it really proved that homelessness can be addressed quickly and effectively. You touched on the need for comprehensive and sustainable responses from whole of society. Just so many great insights. Thank you, Stefan. Um, Let me navigate back over to my window. Sorry. Now we will hear from Eric Makoya. He is Executive Director of Unduga Society of Kenya, and he will share about their work to address street homelessness. Over to you, Eric.
Thank you, Tiffany. And my apologies for having not joined you guys early enough. I hope you can hear me.
Yes, we can. No worries. Thank you for being here.
Thanks. So I will approach the subject from 3 angles. One is, what are the likely causes of what we're experiencing in Kenya, because it's the context is very important. So number one is that we do not have a good definition of what homelessness is. And what that means, therefore, it is easy to confuse homelessness and the absence of adequate or quality housing. And so that's one of the things that we are dealing with. And that therefore means that even at the state level, the kind of interventions that are provided are ill-informed, they lack evidence, and they are not knowledge driven. And thanks for what Prof has just shared. I mean, it is quite rich in terms of what evidence are we looking at, what knowledge data sets do we have out there, and how then does that inform policy and practice going forward. So in Kenya particularly, we have two levels of urbanization that have really caused or exacerbated homelessness. One is the issue of the general rural-urban immigration that happens in Nairobi, being as a city that has been there for a long time, then suffers the bigger wrath of this. And just to coincide with what Prof has said, 60% of people who live in Nairobi actually live in informal settlements. And he's right by saying that homelessness then is hidden under the aspect of informality, yet it's quite a huge problem. But the second level of urbanization is that since 2010, when Kenya adopted a new constitution, we have counties that have come into place, and the resources politically have been taken back to the counties. What this has done is that we have emerging urban centers within counties. And so we are experiencing homelessness in places that will have not had homelessness, because then people are moving towards where they can have income pathways that are more sustainable. The other aspect is, I think, Kenya being peaceful, as they say. We have the issues of refugees and asylum seekers, but also in that context, we have the issue of human trafficking, that then it is a pathway where people then are trafficked through, either to come and rest as they go wherever they need to go. But when that doesn't work, then they end up on the streets. And when they end up on the streets, it means homelessness then speaks to them. The other aspect, I think, is the education system that we have. If we are looking at the root causes, is that we have an education system that seems at the very best from the, for lack of a better word, from the very worst in terms of intelligence. So the people who perform very well, because we are an exam-led, we've been an exam-led education system, then proceed to more advanced levels of education. But the people who remain behind have no alternatives. And that means they'll end up without skills, they'll end up without college degree, they'll end up without a college certificate. And what therefore means they are left to engage in very exploitative labor conditions in terms of the kind of work they do. And sometimes, because the homeless people don't have certificates, they end up working in dump sites, and a number of other areas. The bigger question, however, is the land question in Kenya. How do you deal with the land question? For example, we know that people who stay in Nairobi, 10% stay in uncontested land, that is still informal settlements. 50% stay in private land that was previously public land that has been privatized by government to individuals. Yet those individuals stay in that land, meaning the time the owners of the land come, they'll be evicted. And when they're evicted, they'll have nowhere to go. The other bit is we have 40% that stays on contested land, that they are there temporarily. So we are saying we have 95% of people who are living on land that is not does not permanently give them an abode. It actually predisposes them to a lot of risk. And the whole question of corruption. So that, for me, explains what are the root causes of these issues of homelessness. And corruption then has come up with also what I can call short-term programs, the humanitarian programs that people do. I mean, the street feeding programs, the money-giving programs that are not based on any aspect of longevity, meaning sustainability is a problem, and that means then people stay on the streets longer. But having said that, the big question is that then what does Undugu do? So Undugu, for the last 53 years, has decided that they'll address homelessness in a number of ways, both preventive and curative. And we focus on children, we focus on youth, and we focus on households. And we're talking about households, then we focus on the informal settlements. And we have a matrix that then we look at and say, who are these people who are likely to end up on the streets? And once we do that assessment, then we focus on those households for a number of interventions. So our interventions are economic in nature. They are social in the context that we work on the psychosocial aspects of people. solidarity aspects of people, but importantly on the mental aspects, because most of the people who go on the streets, they're either on drugs, they are on a number of things. So we have a 3R model, which is rescue, rehabilitation, and reintegration. And with this model, we intend to achieve 4 things. One is we must prevent, reduce the inflow of people into the streets, protect, meaning that you are already there, and we need to give safety and services that are required. And this was worse during COVID-19, so I was glad when the Prof spoke about it. And that aspect is provide case management and livelihood. And this means that we will offer legal aid. We do a lot of public legal clinics, just to ensure that people then understand that homelessness is not an identity, it is a condition. Because what has really happened is that homelessness has become an identity. And it's an identity in the context that if you look at the law, we have criminalized poverty and criminalized livelihoods that most of these people are engaged in. And after that, then we're saying, can we sustain? And sustainability means we have an aftercare program and we reintegrate it back to the community. And so this is what we do. We have 3 models. So one model is what we call street youth association. And we talk to youths where they are in terms of where they meet regularly, where they sleep. It could be in an alley, it could be under a bridge, it could be along a riverbank. And we speak to them, engage them, train them, make them self-aware of what they are going through, and look at what are the major problems they're facing and try and intervene. Then form them into an association. This association gives them some legal identity, because then it's registered by the social services of government, so that then they can negotiate with government on a number of things. Remember that most of them don't have legal documents. They don't have birth certificates, they don't have national IDs, so it means they are never part of the mainstream economic system of government. You cannot get an employment unless you have an ID. And what that means, therefore, they are left in very exploitative labor relations. The other aspect is where we do community children right clubs, and this is focusing on children, particularly very preventive. Even the ones we rescue directly from the streets, we take them to our rescue center. We have a rescue center, just to try and remove them from the street mentality and then put them into this community child right clubs. And these clubs teach children between the ages of 6 and 17 about human rights, about violence, that they need to be aware of this, but most importantly, knowing what are the symptoms of somebody who is likely to the street, a child is likely to go to the streets, so they also become the red flag bearers, that this family is likely to experience this kind, our friend is likely to experience this kind of scenario. These clubs, so far, I think for the last, let me just take for the last 4 years, we've dealt with about 4,500 children in different cities in Kenya: Nairobi, Mombasa, Eldoret, Kisumu, and Kilifi. Then we have the third one, which is largely livelihoods, and this is where we focus on households, is what we call village savings and learning associations groups. We put mostly, and unfortunately most of them are women-headed households or female-headed households, and we put them into groups and teach them some financial literacy, entrepreneurship, and out of that, try and see whether they can use their own resources to get into a culture of saving and a culture of learning each other and doing enterprises that they have control over. For example, if all of us must buy flour, just give you an example. Kenyans eat ugali. Ugali is one of our staple foods, and we use corn flour. And if all of us must buy flour as a group, we'll not go to a shop. We'll go to a wholesale, buy the flour as a group, and sell to each other. So the 10 shillings that was profit that would have gone to a shopkeeper will come to our group. That kind of enterprise. And for the youth, what I forgot to say is that these associations are then taken through a mind shift program, where now they start thinking of what vocational skills they need to have, what kind of enterprises do they need to have, because most of them are in groups. And because we know they have money, because they buy drugs, we try and let them know how best to rechannel that money to gainful economic situations, which can actually help them. So these 3 models is what we use. And we have told ourselves that the reason for doing this is to reduce, one, that homelessness is not an identity, it's a condition and can be dealt with. But also to bring out the message that homelessness is where housing, health, social protection, and livelihood fail at the same time. That then you are at this intersection where you cannot do anything. You are at the mercy of the system. And also saying that homelessness must be made visible. It must not be hidden under the issues of informality. With this, I can tell you that just for the past 6 months, we have taken about 256 young people who previously were engaged in commercial sex, young people who previously were engaged in crime, now taken through some vocational colleges. And those colleges are the ones which are not asking for certificates. So we do that as one aspect. But the other aspect is apprenticeship, where we attach these young people to businesses for people who understand, the business community that understands, and private sector, so that then they can learn on the job. So our conversation now going forward is, can we find a way of making them have certificates? And so a bit of negotiation with the two institutions. We have an institution called NITA and an institution called the Kenya National Qualification Authority, where we are saying, can we now find a way of certifying these people with their skills, even if it means us developing some kind of an exam? So this, for us, is both preventive and curative. But as we say, we are not Jesus, so we can't save everyone. We have networks, but they're not strong. The Sumu network for street-connected communities is quite strong. Nairobi has a lot of political connotation, and so it has died down. So the idea that people can come together and give the different contexts of citizen and homelessness will be a great thing to do. Thank you. Back to you, Tiffany.
Thank you so much. Great presentation. You taught us a lot about the issue of homelessness in the local context, which we really really want to learn about. You touched on a lot of intersectionality and root causes and pathways into homelessness, which is really important, and really addressing the individualized needs of the most vulnerable communities, youth, children, and families. So yes, thank you. Thank you for your presentation. And any links or resources that you share with us afterwards, we'll be sure to share with everybody. And last but not least, I will turn it over to Sia, who heads the Inner City Federation. He will share about addressing homelessness in Johannesburg, South Africa. Sia, over to you.
Thank you, Tiff. I'm Siyabonga Mahlangu. I'm with the Inner City Federation, which is an organization that is based at Johannesburg, South Africa. ICF was formed in mid-2015 because we wanted to engage directly with the City of Johannesburg officials in terms of access to basic services in the occupied buildings, because people that are living in these occupied buildings, they are not considered as human beings. They are only considered as criminal. Others, they will recall that if they are speaking of those people, they will use hijacked all the time, of which it's a name that criminalizes the people that are residing in these buildings. And then we formed the ICF based on that. And then on, we see that there is a need of protecting and fulfilling the residents of the inner cities, right, in terms of adequate housing, because there were so many unlawful evictions that were happening, and then the city of Johannesburg was not responding to those evictions, of which we started engaging even the people that are conducting these unlawful evictions throughout.
Sia, sorry to interrupt. I just wanted to say that I think there's a bit of your audio is a little choppy, just a little bit. It's kind of popping in and out your audio.
Okay, can you hear me now?
Yes, we can hear you.
Okay. I think maybe it can be the network issue, but I'm sorry about that.
I think we can hear you better now.
Okay. No, I was saying that the Inner City Federation was started in mid-2015 because we wanted to liaise directly with the City of Johannesburg officials in terms of access to basic services. But on a long run, we realized that there is a need of protecting the right of the poor in terms of access to housing, because there were so many unlawful evictions that were happening in that time. Even now they are, but they are not like before. But the City of Johannesburg was not responding on that. Um, we formed this because of those reasons. And then we started challenging our government to say, give us the basic services within this space, of which they refused to do so. We ended up taking them to court on different occasions, where the court will grant an order in the favor of the occupiers or the people within the Institute of Johannesburg. And then after we receiving those orders, they reduced the unlawful conduct of disconnecting electricity and from these buildings. They engage in another conduct now of evicting people from the building without providing them with temporary emergency accommodation, of which we challenge that up until today, in a way that we don't see eye to eye with the City of Johannesburg, because we are saying that performing constitutional duties that we are supposed to do in terms of access to housing, in terms of access to land, access to basic services. So now it feels like we are giving them the job that they are not supposed to do, but we keep on reminding them about how the law works each and every time. So we've got so many cases against them. Even the private sector also, we are doing the very same thing. So now the attitude that they have, they will go to court and tell the court that they can't, rather they admit first that these people that are being evicted, or the evictees, are destitute people, but they can't house them. That means these people, they must be evicted and end up on the street where they can go. Obviously, they end up on the street because they can't afford to go somewhere else without the assistance of the city. That's our argument all the time against the city. But the city doesn't want to fulfill that human right of providing the housing to those people who are directly affected. So there are so many things that are happening within the inner city of Johannesburg. Instead, they will go up and criminalizing people. They will go up opening criminal cases against people, intending people to access their homes at any time, at any given period. So those are the challenges that are being imposed by our local government within the inner city of the resident. That's why we formed this inner city federation. We have participated in some of the commissions and tribunals regarding this very same matter, of which all the time the recommendation will be against the city. That something that has to be against them. Instead, they want to say these things has to be imposed against the president because they are not there fully, they are not there doing right things. They are criminal. They will give out all these names that criminalize their residents. The other things that we fight against, it's a woman's right, where there will be a sidelining of women in whatever activities that are being bought or created by the COJ. They will always put us as men up front to be proactive in that. When the women they want to participate, they will be sidelined by the COJ officials and other stakeholders. And we end up creating inner city federation women's desks that will speak with the women's problem that they are facing within the housing sector itself, because the problem starts there before it goes further, before it goes to parliament, it goes somewhere else. But the patriarchal practice will start within the housing sector. So that's why we created also the inner city federation women's desk, where the women, they will share their problem and make their voices be heard, without the assistance of men, because obviously the people that are outlining these women are men all the time. So that's why we created that desk. And now we are planning to create not a desk, but to create a men's talk where we're talking about the issues that are affecting women, and look who are the cause of those issues in terms of accessing the housing and land in the inner city and outside of the inner city, because we are also working with so many partner organizations. TLF is one of them. Abahlali basemjondolo, UP, the Funguwazi from Cape Town, Madara Center from Kenya, Rooftop from Canada, Reclaim the City from Cape Town, Seri from Johannesburg, Nelson Mandela Foundation from Johannesburg. We are working with so many different organizations, and with the aim of okay. I thought, sorry about that. I thought the issue with the sound is on my side. I see it from my TFS side. They are fixing that. I'm sorry about that. But the ISF we are doing, we're working in quite a number of buildings within the inner city. Now they are close to 100. I can say roughly 131, if I'm not mistaken. I'm talking about buildings, not individuals. I can't give out the counts of the individuals. We are working with occupied buildings, rentals buildings, shelters. So we are trying also to educate our people about their right, and also the very important right that we are speaking about onto them. It's a right of access to property, access to housing, and also the right to access to court. Because most of our people in the inner city of Johannesburg, they do believe that for any person to appear in court, you must have a legal representative that you can pay each and every month or once off. It's called case by case. But we are saying to them, no, it doesn't work like that. Any ordinary person has the right to access to court at any time to represent him or herself, to defend her case. Which one we are trying to engage our residents on. So that's the kind of the work that we are doing as the Inner City Federation. So we are also engaging even our provincial government about this issue of homelessness, on asking the questions: what are they doing? What are their plans of overcoming this housing crisis that we are facing as the inner city Johannesburg residents? We are also in talk again with our national government, asking the same questions, but they will always speak of the issue of money and funding and all the stuff, but they are not proving to us that there is a lack of affordability when it comes to housing. So that's what we are doing as the Inner City Federation. Also, we are doing this not alone as ICF, but working together with our partner organization, as I mentioned, the partner organization that we are working with. So that's the work that we are doing, of which we are hoping that one day we'll achieve what we want to achieve, because we are having a common goal with this other organization. And we are hoping that one day the voice of the poor will be heard and action will be taken once the voices are being heard. That's our hope in all what we are doing, because we are also an ordinary people that are also pro-poor as others. We don't think there's any reason on a given stage that we must be excluded as the pro-poor resident, regardless of nationality, regardless of race. We are all in one. So we must be given the same treatment. We must be given the same benefit. That's what we are fighting for and we are hoping for as the ICF. I think because of time, I will limit my time so that other people will have chance to ask and other speakers have time to respond as well. I think it's right time for me to pause there.
Thank you so much, Sia. That was great. You touched on so many great points about the work, especially like advocating for housing as a human right, and the need for accountability from local governments to address it as a systemic failure. And you highlighted lack of housing affordability, like as a root cause to homelessness. Just so many great insights, and also the collaboration that you're doing to move the work forward is very needed. So thank you for sharing, and thank you for like being patient, and because we had to interrupt a couple times. So thank you so much. Now we will move on to the question and answer segment. So again, any questions that you have for the panel or anything you want to share during the question and answer segment, please use the function on your bottom menu to submit them there. We'll also try to capture anything that was put in the chat, but it's a little harder. So please use the Q&A function. Let's see. We have an attendee who asked Stefan if he can share a bit about the status of the draft green paper, or the process of the green paper being developed into a white paper. I don't know if you can speak to that.
Yeah, sorry, I suppose that's a very localized question. The draft green paper and the recommendations around that and the actual report is the property of the National Department of Social Development. So it's really up to them. They're the custodians of that. And so it's a bit stuck at the moment. We don't have an answer to that question, really. And I assume it's a South African asking the question. I think the national network has the responsibility to now do the advocacy that is necessary to move it from green paper to adoption to white paper. Because the work by the team that has drafted it has been done, but the custodianship sits with the national department. And I think there's action that's necessary. So, I mean, by saying that, I also just want to acknowledge that a lot of when you speak of homelessness and research in this space, I think it cannot be neutral. It often is often a space where research and advocacy live close together. But that's the answer. There aren't clear answers. We are waiting. We actually have written to the department in the last 2 weeks, and we are waiting for a formal response to hear what the state.
Thank you, Stefan. We have a question about the number of people experiencing street homelessness in Tshwane. What are the numbers and what are the drivers of migrant homelessness? And if you have any details about who's like
Okay,
most affected by
those
it.
are all big big question. So our homeless count enumerated 4,177 persons in our in our count. We provided for an undercount of 15%, which we can explain how we arrived at that. However, Statistics South Africa, as I said in my presentation, arrived at a figure that was quite a bit higher, almost 3 times higher, which we couldn't yet explain. And we currently explore whether the difference was in definition. Eric spoke also of definition in Kenya, whether it was in methodology, whether it was just that checks and balances on the count night was not in place properly, either in our count or in their count. So because we're now doing it together this time around, I hope we can be able to answer that question better in May or June. But that is so our count arrived at 4,107 persons. I want to add to that, though, if I can just quickly, is that the count is one thing, the numbers, but whether it's 4,000 or 5,000 people, in my mind, is not the most important. We accompanied the count with a survey that is literally 5-6 minutes to fill out. About 80% of the people we counted also completed the survey, and that actually gave much more helpful information. For example, access to services, nationality, gender, how long people have been on the streets, those kinds of stuff. So I think that kind of data are probably even more helpful than the actual numbers, although we want to get as accurate as possible about numbers. On the migration, I mean, I wouldn't say that I have that. Is that also for me, Tiffany?
I think it was part of the question. I believe so.
Oh, it was part of the question. Well, I suppose we'll have different responses to that, even of people on the call. If I can just speak from Tshwane, migrants literally from all over. If I think of predominant people. Also, I want to say that in our homeless count, we found a very small percentage, despite public opinion, a small percentage of transnational migrants find themselves homeless. So people have other livelihood strategies and other housing strategies. So the predominant number of homeless persons are South African in our count, but migrants come from all over. Zim, the DRC, Lesotho, Ethiopia, Somalia, Nigeria, and various factors, poverty and livelihood issues, sometimes access to healthcare, that might be better in South Africa, which is now also becoming increasingly difficult for migrants. Violence where people come from. Sometimes people come here for studies and then find themselves in South Africa. There are economic opportunities, but also crime opportunities. So all of those are reasons. And so it's not there's not a one answer. But then often it's, people would come from a certain place, they would find it meaningful, put down roots, family members will come, friends will come. And so certain communities will change from being mostly South African to mostly Ethiopian and so forth in a context like ours.
Thank you, Stefan. I will just take 2 questions for Eric. So the first question, Eric, you mentioned in your definition for homelessness that you have not yet been developed. Are you leaning towards any examples from other countries or other cities? Or what have been the factors to consider as Kenya? It's another question for you that you can respond to. What have you learned from your youth homelessness situation that you would about that could be used elsewhere? What works and what doesn't? If you can respond to those 2.
Number one, I think I didn't hear Mokwen, I didn't hear you very well. I heard the first question clearly, but the second one I didn't hear very well.
So the second question is asking about your youth clubs. Yes. What are the lessons? What are the lessons that you have learned that are working, and what are the lessons that are not working that could be replicated somewhere else to prevent homelessness?
Okay. Thank you very much for those 2 questions. Great. So I need to begin by saying that we have not run away from any definition. We have tried to put our definition as an organization, and we are saying that homelessness, it is the collapse. It is where health, social protection, livelihoods, and housing have collapsed simultaneously. That you are in a state of living that does not, a state of being that does not permit you conducive and dignified living. So we are not looking at adequate housing or inadequate housing. We are looking at the wholesomeness of a failed system of basic rights. That is the basic right to clothing, basic right to food, basic right to housing, basic right to good sanitation, basic right to good water. And if you go to the special rapporteur for adequate housing at the UN level, they've only spoken at homelessness as an offense to dignity, an offense to non-discrimination, but they haven't really defined what homelessness is. So in our context, we say that it's the collapse of all these things together. And at that point, then you have nothing to do, but you're left desperate. And some of the desperate mechanisms of survival will be going to the streets, will be engaging in survival crime, will be engaging in survival commercial sex. And so this number of dynamics. In terms of what we have learned with the youth clubs, very good things and sometimes very difficult lessons. Number one is that the street youth we are dealing with are likely already in drugs. And so we have already an uphill task of reforming them from drug use. And we don't take them to rehabilitation centers because we believe good resilience is built where the supply chain is. That if you're able to resist drugs where there's the supply, then we are building more resilience in you than when you remove from supply and reduce your craving. When you come back, you still have the craving. So lesson number one is that you cannot have a working street youth association with complete reform from drug use. We endeavor to reduce the drug use and abuse, but also we endeavor to remove them from some of the survival criminal mechanisms. Survival criminal mechanisms, what do I mean? They will be stealing your phone to go and sell so they can buy food. They will be mugging you on the street so that then they can find something for their children. So when we remove you from this, what is the alternative? The alternative, which is a lesson to us, is that with consistent income from a legally accepted but also socially recognized mechanism, gives them more leverage into the society, and therefore they leave the issues of the streets. Number three is that as a community of these particular conditions, they likely understand their problems better. They likely have solutions, and that's what we do. And we use those lines of solutions through what we call trade choosing workshops for them to decide what exactly they want to do, whether they want to do some businesses or not, or whether they want vocational trainings at an individual level or not. And we follow that path. But then we have also realized one thing, which will be the fourth lesson, that utilizing or exploiting, as bad as those places are, their economic livelihood pathways, which mostly are dump sites, or I think in the other languages, landfills. Utilizing the resources, which is the waste, into some circular economy, has been part of what has revived them from streetism and homelessness. So we have encouraged a lot of environmental and climate change projects within their economic or livelihood value chain. That because they are certificate inadequate, they are school shy, means that the mainstream cannot accommodate them. So how do we make the informal work for them? And that is why we have gone that path. The last lesson I think for us is, if we create a pathway where governments recognize that these are people we must talk to and they're not criminals, and they are not identified, they're not profiled in a way that reduces their dignity, the registration which is allowed then gives them room to engage with mainstream government, give them room to advocate for national identity cards, give them room to negotiate for birth certificates, and gives them room to engage into programs that are run by government that mostly are digital in nature. And so we have many lessons, but these 4 or 5 I've mentioned are key for us. And this model is replicable anywhere else, depending with their context. But if the Kenyan context has worked, we have tried this in Tanzania, it has worked. We tried this in Senegal at some point. And so I'm thinking that it is something, if contextualized within the particular region, looking at the unique dynamics, it will actually work for all of us. Thank you. Back to you, Mokoena.
Thank you. I'm going to ask 2 more questions and hand over to Julia. And you might not be able to respond to this, the first question to our panelists, but I think you need to think about it. It says, what would you hope are the top 3 subjects an African Homelessness Network would work collaboratively on? Remember, in the introduction, one of the aims of this webinar. So what do you think are the top 3 subjects that this African Homelessness Network could work collaboratively on? And then the last question, it's being asked by an attendee who is from California in the United States, and also acknowledge they do homeless counts each year there. So the question is, how often do you in your cities gather this information, or how often do you do homelessness counts, and who usually participates in the counts, and how is it done? And she also mentioned that in California they count at night so that they can see where the people are sleeping. So if you could just respond to that, perhaps Stefan did speak a bit around this second question, but I think briefly, if you can respond to the questions that was just posed here. And after your responses, Julia, can you please take over?
Okay, thanks. Let me say, now that I have the privilege of the microphone. So number 1 is just to answer the last question. Any data that we collect is collected at night. We do what we call street visits. It is where the homeless people, because they have a high mobility, it's where they sleep. In Kenya, we call those places where they sleep bases. So the base where they sleep is where we have conversations, usually late at night. And we avoid, because of insecurity, we avoid sending female staff out. Mostly our male staff, and female staff then are accompanied because of the dynamics of the night. People involved in this is just Undugu staff. In terms of data, which is something I'll speak to, in terms of what can African network want to achieve, data that we have is anecdotal. It is our data. It is not national. The national data that we have that was done by government is 8 years old. There's rumors they did some census last year. We don't know what kind of instruments they used, because from where we sit, we need special instruments to be able to deal with the informality that comes with homelessness. And this we do almost every day, because this is the work we do every other time. Has been our work since 1973. And so I can't say we have a specific time. We get data every day. So we have data about the people who are new on the streets, the people who've been there longer. We even have data indicating that we are now having the 5th generation on the streets, and because we have consistent data. On the question of what can African Network of Homelessness achieve, number 1 is data. Can we get data that can help us develop initiatives that are data informed? Because as we speak right now in Kenya, and I'm sure in everywhere else in the world, there's very little data that shows the reality of the situation on the ground. Number 2, we need to expand the definition of homelessness from adequate or inadequate housing. And me thinking that once we do that, are we able to talk about low-cost settlements rather than affordable housing? In Kenya, we have an affordable housing program run by the president and his cabinet. Affordability is an issue. And if you look at affordability and the kind of housings we are creating houses, skyscrapers, which means they are flats and apartments, built on a sewer system that is 63 years old. meaning we are making vertical slums. If we start looking at low-cost settlement, then we start looking at the holistic question of what does it mean to have a good settlement in terms of people looking at the four basic rights that I mentioned. And the last thing I think it will just be, are we able to share strategies? Are we able to share interventions that have worked very well in this country and see where they can be tested elsewhere? Thank you. Back to you, Tiffany.
Thank you, Eric, for those very thought out and thoughtful answers. I think we have time for one more question. So there's one to Sia about criminalization and how to, do you have any practical tips for campaigning to overturn loitering or vagrancy laws, and how your organization has confronted that? So Sia, if you're able to answer that question, and we can also share resources from your organization as well.
Please repeat the question for me again.
Do you have practical tips for campaigning to overturn criminalization of homelessness, and also loitering or vagrancy laws? If you're able to answer, it gives some from your perspective.
Yes, I'll put it in a short form so that everyone can understand, because it goes country by country or city by city. But here, if we are speaking of homelessness, it's where, firstly, number one, people will be evicted and there will be nowhere else to go. That's the first definition that we give to homelessness. Number two, when there is no water, electricity, or sanitation, there is no home. Those people, they are living nowhere. That's another definition of homelessness. So for us to prevent those things to happen, we'll have to make sure all the time that the city provide the basic services to the communities and make sure that no one is being evicted without the provision of temporary emergency accommodation. So that what we give this definition of homelessness when it comes to ICF. It's how we give the response to that, because we can't say homelessness, it's only where you are sleeping on the street, you are rendered on the street. No. But without some certain basic services, there is no home. Yes.
Yeah, great, thank you. And I think that that ties into our conversation as well about the need for a comprehensive definition that's really being able to adapt it to local context. So I think there's a lot of energy around the need for an African network and a need for follow-up, and I think part of that will be at our next conference in South Africa. But I'm going to turn it over to IGH's Executive Director Pete Mackey to do some closing remarks.
Yeah, thanks, Julia. And look, thank you all. I'm going to spend 1 minute because we're taking up a lot of your time. Mostly just to say a huge thank you to all our speakers and conveners, to Tiff, Julia, Stefan, Eric, Sia, Remembrance, but also to everyone that participated. We did not get through all of your questions. There are still some really important questions in there, which just shows the need for this ongoing and wider dialogue, cross nations, cross cities, across Africa in particular. So huge thanks for participating. Look, I did say I wanted to offer, just a couple of reflections looking across. So a few things that stand out. Undoubtedly this importance of knowledge and data relates to visibility. Your point, Stefan, about everybody counted counts, I think is such a powerful phrase. Let's get our data right, but it's not data for data's sake. It's data that is then actionable, and we talk about that a lot at IGH. We have that so that we can deliver action locally, and that ties in with some of the comments and the questions that are emerging about this has to be something that lets us understand our local context and act on it. That tension and challenge of the invisibility of homelessness, particularly across African countries as it relates to informal settlements, is something that we've not yet resolved. That is definitely a tension that we need to pursue further. I heard a lot about political will and collaboration. So the mentions of what happened in COVID when it was a crisis for everybody, homelessness is still a crisis. We should still have that level of collaboration that so many of our speakers were calling for. Um, so really a call for political will there, and that Eric's really clear point about the cumulative failures around health, social services, housing, that is the driver of homelessness, and they have to be part of the solution. Um, on collaboration, the call that we heard for the African Homelessness Network, yes, 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 and if IGH can help support that in any way, you have our help. Um, Working from a European context for me, I've seen how powerful those networks are. Fianza is our equivalent in Europe, and it's been incredibly helpful. I heard a lot about discrimination, particularly in relation to women and migrants, and some of the work that's being mobilised. And also the importance of using all of our levers available. We heard about delivery of affordable housing, although Eric challenged that and talked about low-cost settlements, about campaigns, legislation, um, land rights, livelihoods and community savings, circular economy, all the levers available to us to address homelessness. And particularly we heard about early intervention in the Ndugu example. And finally, I'll just say I heard about us challenging homelessness as an identity. It's a systemic and structural failure of society, and that's a global failure. So I heard that loud and clear, and the importance of mobilising voices to really address that. There was a very good question in there that mentioned Nelson Mandela that I thought was very powerful, and I'll take away. That's it for my summing up. It was fantastic. I'm so grateful to everybody. Last reminder, our conference. I don't know, Julie, if you can post the text in the chat about this, but just the conference that will be in Tshwane, University of Pretoria, January 26th to the 29th. You can submit abstracts for this up until March 20th of this year, and we hope to see as many of you as we can at the event. A huge thank you, and do anticipate a follow-up email. Diolch yn fawr. Thank you.
Thanks, Pete. Thank you, everyone.
Thank you. Have a lovely time.
You too.
Thank you.
Thank you all.
Thank you all.
Bye.